This man died out of ignorance. He died out of ignorance. He said in an interview that the same thing that killed his father, killed his two brothers, and eventually got to him. Look at him on his deathbed in his birthday, and his leg, they want to amputate his leg because his leg is rotten. Most likely because of diabetes. And on his birthday, they managed to prop him up to sit down. And his family brought cake for him. They brought cake for him, which is a bunch of sugar. A bunch of sugar. A bunch of sugar. His body is no longer able to regulate sugar, and you are bringing a bunch of sugar for him. And he said it's the same way his father and his two brothers died. This is a family, possibly, from my own estimations, their body is not able to control sugar. In a way, it might even be hereditary. I never saw his medical report, but from the symptoms we are seeing is diabetes. And on his birthday, they brought more sugar. Who even told you that they should cut cake on birthdays? Who even brought that rule? Who brought the rule that birthdays, they should have cakes on birthdays? Cake is just a bunch of sugar for people that can handle the sugar. And this is a family that possibly have diabetes problem, and his children are here. I would have shown the video, if not that I don't want to show the video of the other children that are here. And they are still introducing a custom and tradition of sugar. Your patron, your dad or grandfather is dying from sugar, and you people are eating sugar on his birthday. What a bunch of idiots. The adults in this family need to reevaluate their health procedures. So in this family, unfortunately, the father died a certain way, according to Mr. Ibo. I wanted to show the video, but I will not show it because I don't have the permission for that interview. And then his two brothers died the same way. And in that interview, Mr. Ibo was saying that it's poisoning. How can it be poisoning? Okay, so let's say it's poisoning. Your father is poisoned. You people did not take precautions to prevent that. One of your brothers is poisoned, no precautions. One of your other brothers is poisoned, no precautions. He himself in that interview said that he too was poisoned. And somebody took him to a place where he vomited the poison. That's not how it works, sir. I made this video earlier, and when he was still alive, but I deleted it out of respect for him. You know, he might see it and feel so bad, and his situation will get worse. So I decided to just bring down the video. People that follow me on my channel knew I made that video. How can you be feeding him cake and teaching the children around to take more sugar? I used to have a lecturer that said that diabetes killed his father and his uncle. So they banned sugar in their household. Because these people died at their 40s. This man died at 72. He topped up at least 30 years on top of his family tradition of dying young due to sugar. Because he cleared sugar from his household. A respectable lecturer. So if you have this sugar problem in your family, that every time people's leg will start rotting, from there they will say they want to cut off the leg, from there the person will die, you have to cut off sugar. You're already getting enough sugar from your regular food. Your regular yam that you eat, your regular starch rice, you're getting enough sugar. Anything sugary, cut it off. You don't need soft drinks. You don't need all this. Unless you're having low sugar issues, then doctor can recommend it. Are we not going to call out the hospital? Hospital that was treating him and the treatment failed. I know we have been all trained and educated not to call out hospitals and quack doctors. This hospital should have referred him abroad. He had enough money to be shipped abroad. When he called out and people started donating, people donated up to at least what I read on the internet, 300 million naira. Let's even say it's 100 million naira. Is that not enough? Even 50 million naira is enough to take this man abroad and get him treatment. Why? I don't know whether the hospital did it, but I did not read it anywhere. Why is it that they did not tell this man, we cannot treat you? They put the man on bed, put the injection. In this video of his bed, there is drip. What is the drip doing? When you know that it will not treat the man, they will be pumping drip inside your body. Many people have died like this. Hospital will just be putting drip inside their body, pumping them with antibiotics, knowing that this person will not survive, instead of referring the person to a hospital that will treat the person. Many people die out of diabetes exactly the way this man died. At least I know 2 people that died this way. They will go to hospital. Hospital will be giving them drugs, knowing that the drugs will not treat the person. The more they give the drugs, the more the body of the person is rotten. Before you know it, doctor will show up with a saw and say they want to cut off your leg. If they don't cut off your leg, you will die. You will not pay for cutting off your own leg. After paying and they cut off the leg, before you know it, they will say they want to cut off the other one. You have to pay again. After paying again, within 2-3 months, the person is dead. The person is dead. How come? That means the cutting of the leg did not work. But they will still charge money per diabetes patient to cut off the leg. If you know you don't know what you are doing as a doctor, don't do it. Refer the person to India or abroad or to a good hospital in the country that can handle it. We have come to an era where hospitals claim to be treating what they are not treating. I know of a person that had stroke. I think they call it brain aneurysm. Doctors, correct me if I'm wrong. Meaning that blood is leaking in his brain, inside his skull. One of the veins or the arteries have burst and blood is leaking inside. We know that the treatment of that is to drill the skull and suck out the blood. This hospital does not have the means to do that, and they will not refer the patient out. Now, the patient, out of ignorance, does not know that this is what they should do for the person. And they'll be giving the person antibiotics. Go and do MRI scan. Go and do this scan. Go and do that. And they'll be referring to the person. You'll be burning money. The money you should have used to ship the person to a hospital that can handle it. You'll be burning money, but before you know it, all those drugs they are giving the person will die sooner than they should have even died. Some people need urgent surgery. The hospital cannot do the surgery. They will be giving you antibiotics till you die. So guys, look at this. So they will not tell you this. Look at this. It says, according to a study, the 5-year survival rate for diabetic foot amputations is 40%. That is only 40% of people they have cut their leg will last 5 years after. Once they cut your leg, 60% chance that you are going to die within 5 years. And the 10-year survival rate is 24%. Keep reading. Another study found that 5-year survival rate of diabetic foot ulcers is 70%. So if you have a foot ulcer, your leg is rotten, there is a 70% chance that you will last 5 years, 30% chance that you will die. But once your leg is cut, it's 40%. But drops to 43% after a major amputation. Once the person's leg is cut, the chances that they will survive 5 years drops from 70 to 40. I don't want to misrepresent these statistics, so I'll leave it for doctors to explain. You understand? I'll leave it for doctors to explain. Now, keep reading. It says, amputation alone is a predictor of poor outcome of patients with a 30-day mortality rate of between 8 and 23%. Think about it. It says that if somebody's leg or hand is cut out, especially for diabetes, if somebody's leg or hand is cut out, that they are 23% likely to die within 30 days. 30 days. 30 days. Think about it. If they cut off the limb of somebody, 23, that is, if 100 people have diabetes and they cut off all their leg, that within 30 days, 23 of them will die. That is what I understand. If I'm misrepresenting it, doctors, please correct me. He said 33% of people with major lower extremities amputation die within 1 year, and 65% within 4 years. According to the American Diabetes Association, 154,000 people with diabetes undergo amputation each year in the United States, as high as 80% of non-traumatic lower amputations and so on. So I want you to read up this. That's why I even allowed this. This is the article. So you read it up and correct where it's wrong or where I'm wrong. But the point I'm trying to drive out is that if you are in the hospital and they say they want to cut off your leg, at least consult another hospital or do more tests or ship yourself to a better hospital if you're not in a good hospital, so that you can be sure that that's the right thing to do at that point. We are not calling out